Okay, so this is going to be a short lecture on prioritization and delegation in the clinical setting. This is more to help you think about your new role after graduation. You will be the registered nurse. You will be working with individuals on a team. Some of them may not be licensed. Some of them may have a different license. And so when you are delegating tasks, you need to consider who you are delegating to and what tasks you are delegating to them. And then also prioritization is going to become key in your new role as the registered nurse, knowing what needs to be done first. Okay, so prioritization, the definition means that you are deciding which needs or problems require immediate action and which actions can be delayed until a later time because they are not as urgent or important. And so when you are thinking about prioritization, you need to think about the purpose for care. Why are you providing this care at this time? You need to look at the current clinical practice, and you need to kind of picture the outcome or the result in your head before you decide what you want to do first and what can wait until later. So prioritization in the clinical setting is a process that includes envisioning the patient outcomes. It includes predicting possible problems if another task is performed. And you also have to weigh potential future events if the task is not completed. So the time it would take to accomplish it and the relationship of the tasks and outcomes. So you not only have to consider what needs to be done now, but what happens if I don't do the right thing now? What happens if I put off doing another task? So you have to think of the outcome. What is going to happen when you decide how to prioritize your care? And so it includes evaluating and weighing each competing task or process using the following criteria. So you need to think about what needs to be done, what is going on with your patient at the moment. Is this a life-threatening or potentially life-threatening situation where if a task is not done, then there will be severe consequences or a poor outcome for your patient? Would another patient be endangered if this task is done now or the task is left for later? So prioritization not only refers to providing care to one patient, but when you are a new nurse, you are going to have a team of patients. And so you're going to need to decide which patients need to be seen first. And if I see this patient first, is it going to put another one of my patients at risk? Okay. Is this task essential to patient or staff safety? Always think about safety. Okay. And so if safety is an issue, then that task probably needs to be performed. Is it essential to the medical or nursing plan of care? Meaning, use your Maslow's, use your ABCs. Is it essential right now to this patient's plan of care? Okay. If it is not a priority at the moment, then it can be done later. Or if it's not even related to what is happening with your patient now, then it's not part of their care. So 3 levels of prioritization. Okay. Once again, we're going back to the ABCs: airway, breathing, circulation. Okay. You also need to consider V for vital signs. You need to know your patient's most current vital signs because those will help you prioritize which patient needs care first or what action needs to be done first for a specific patient. Okay. So airway, breathing, circulation, and include vital signs in that. And then the second level, Think of things such as, has there been a change in the patient's mental status, their level of consciousness, pain, okay? Has their pain changed? Elimination, and we're talking about acute. Is there a sudden change in their elimination? Lab results should be considered when prioritizing. Are there any labs that are abnormal, out of normal limits? Okay, and once again, risk to safety. And then the third level is where you move on to more long-term. So level 1 and level 2 are your acute changes, okay? And you need to address acute situations, a sudden change. Level 3 is where you may be looking at more long-term issues that need to be addressed, possibly maybe before discharge, okay? And then always consider Maslow's hierarchy. Maslow's can be used to prioritize from the most crucial survival needs to needs related to safety and security, and then affiliation, relationship, self-esteem, self-actualization. So you always need to think in the context of the patient's situation, okay? And so that will determine whether you use your ABCs, whether you use changes such as mental status changes, abnormal lab results, or more long-term issues. Now, assignment and delegation. This is going to be very new to you as a nurse in charge of a patient team. So there is a difference between assignment and delegation. So assignment, you can see, is routine care activities, procedures that are within the scope of practice of each person on the healthcare team. So everybody has their own scope of practice based on their license, what kind of license they have, whether they are not licensed. So assignments are just those tasks that each individual is allowed to perform. LPN is licensed practical nurse. Sometimes you may hear them referred to as a VN or vocational nurse. And then AP is your assisted personnel. You may also see them referred to as a UAP, an unlicensed assisted personnel. This would be your CNAs, maybe your techs, okay? And then when you delegate a responsibility or delegate a task, you are delegating a nursing activity, skill, or procedure to another person, which is called the delegatee, okay? So the person who makes the decision to ask another person to do something must know that the chosen person is competent to perform that task. You always need to know the abilities and the skill of those you are working with. Because if you delegate a task to somebody who does not know how to perform that skill or is not competent in that skill, then you are putting the patient's health at risk. So the RN selects the particular task, given his or her knowledge of the individual patient's condition and the particular circumstance. So once again, you have to look at the whole picture. You have to look at each specific situation. And according to licensure and statutes, the nurse is obligated to delegate based on the unique situation, the patients, and personnel involved. And once you delegate a task, you are not done with that task. It is up to you to follow up on that task that you delegated to another individual, okay? You don't just pass it on and you're done with it. You are the person in charge and you have to follow up. So the delegator, of course, that is the one who delegates the responsibility, a task, or a skill. The delegatee is the person who is going to perform that task given to them. And so if you are doing delegation, if you are overseeing a team, the person who makes the decision to ask another person to do something, once again, must know that that person is competent to perform that task, okay? And you have to think about all of those other things we mentioned previously as far as scope of practice, licensure, statutes. Okay, a couple other terms that we've already kind of mentioned, the licensed nurse. There are many different levels of the licensed nurse. The APRN is the advanced practice registered nurse, or your nurse practitioners. Registered nurses, those who have sat for the state boards, that would be you with a bachelor's degree or an associate degree. Your LPNs and your VNs, licensed practical nurses, vocational nurses. Now, one thing to know is when you go out and you start your first job, depending on the facility, depending on the state that you are working in, LPNs and VNs may have slightly different scopes of practice depending on where you are working. So it's important that you become familiar with their scope of practice and what is allowed to be delegated. And then we talked about the AP as your assisted personnel. These are individuals working on your team that are not licensed, okay? You can see here the difference between when you delegate, you are supervising and you are still accountable, as I mentioned. So delegation is just the beginning of the process. Assigning a task or passing on a task to another individual on the team is just the beginning, because you are accountable for that task still. You're accountable for the outcome of that task. And so you are in a supervision role as you are still overseeing that that task is being done correctly and that whatever results of that task are accounted for or results are directed to the appropriate people. Okay, so as for accountability of the delegatees, the person you are delegating to also has accountability. They are accountable because they have accepted the task. They have agreed that they are capable of performing that task. Okay, so for example, nursing assistants who are unprepared or untrained to complete a task should say that when asked to perform a task. If they have not been trained, if they are not knowledgeable of that task, they need to let the nurse know and not accept that delegation. Okay? And then it is the nurse's job to continue throughout the performance to monitor the performance and the results of the task delegated. So as you can see, a delegatee is allowed to perform specific nursing activity, skill, or procedure that is outside the traditional role and basic responsibilities of their current job if they have obtained additional education or training or certification to perform those tasks. So if you are passing on a nursing task or skill to an AP, they must have received training and been validated as competent to perform that task. The one thing that comes to mind is there are some areas, some hospitals where they may train the APs to insert Foley catheters. Well, they can only do that if they have been trained and certified, okay? So the context and processes associated with competency validation will be different for each activity, skill, or procedure being delegated. The competency validation should be specific to the knowledge and skill needed to safely perform the delegated responsibility. So it's not just that they've been trained, it also, patient safety needs to be considered. Can they perform that task competently and safely for the patient? Okay, nursing judgment. If it is a task that requires a judgment to be made about the patient's situation, then that cannot be delegated, okay? Nurses are the ones that do the assessing. They develop that judgment as to what is happening, what needs to be done. Now, you can ask an AP to get vital signs for you, but what gets done with those vital signs is the nurse's role, okay? And you can also I forgot what I was going to say. Sorry. The main thing is remember scope of practice. Okay. Become familiar with the scope of practice, as I mentioned, of the different individuals that you will be working with on a team. And then nursing responsibilities are delegated by someone who has the authority to delegate. So you have to be in a position where you have that ability to delegate. Okay, so that is meaning that an AP cannot delegate to others. They are not in that position. Okay, your LPNs, your VNs, depending on the context in which they are working, they may have some delegation ability. Maybe if they are working in a nursing home, a long-term skill facility where they are in charge, then they would be able to delegate to APs. Okay, so it's really important to know the context of the patient care situation. Once again, scope of practice. It's very important to know scope of practice of everybody. And remember that clinical reasoning, nursing judgment, critical decision making cannot be delegated. That is the nurse's scope of practice and role. So regardless of how the state or jurisdiction defines delegation as compared to the assignments, appropriate delegation allows for transition of a responsibility in a safe and consistent manner. And so this is just delegation put into kind of a graphic. It's telling you that, just pointing out that delegation is very multifaceted because it includes scope of practice, it includes competency, training, the context of the situation, the context of the facility, the state. So delegation actually begins at the administrative level of an organization because they determine what can be delegated, who it can be delegated to, and under what circumstances. So they develop those policies and procedures. The licensed nurse must be responsible for knowing what their patient's needs are and when it's appropriate to delegate. They need to evaluate the outcomes. They need to stay accountable for anything that they have delegated to another person. The delegatee, or the person who accepts the responsibility of the task, must accept activities or tasks based on their competency level. They must maintain competence for delegated responsibility and maintain accountability for the activity. So once again, if they accept a task, they are saying that they are competent to perform that task. And so this is just, you can just kind of look over this. So responsibilities of the licensed nurse. You can just kind of look through these. The licensed nurse, once again, needs to know when and what they can delegate. And it becomes within the context of each patient's situation. Okay? Facilities will have different policies. States may have different guidelines or policies. The licensed nurse must always stay in communication with the person that they delegated the task to. Remember, you are still accountable for that task. You are accountable for the outcome. So you need to stay in communication with the person that you gave that task to. Once you pass on a task or delegate a task, you are now in a supervising capacity. So you need to be available for that person. Even if they have received training, even if they believe that they are competent, you believe they are competent, there may be questions that they have. They may need some guidance. So it's important that you are available. Remember, you don't just pass on the task and it's done. You're no longer responsible. You are still responsible for that task. Okay? Okay, communication. Once again, it is important to stay in communication with everybody on your team, who you are delegating to. Be receptive to communication from the individual that you are delegating tasks to. Once you start to delegate tasks, it becomes teamwork between the nurse who is delegating and the person who is accepting that task. Okay? If there is no communication, this is when bad things can happen and you will have poor patient outcomes. So responsibilities of the person accepting a delegated task. They should only accept tasks or skills that they have been trained and educated to perform and that they feel comfortable and competent in performing. Okay? They must maintain competency for any tasks that could be delegated to them. So they need to keep up on their education, on their skills. Okay? If delegatees accept tasks that they do not know how to perform, have not been trained, then we are going to have poor patient outcomes and we are putting the patient's health at risk. Once again, communication. The person that you give that task to must communicate back to you. They must communicate back to you, how is the task going? Were they able to perform it appropriately? If it was taking vital signs or measuring output, well, what was that result? They need to communicate that back to the nurse, okay? And then they need to verify that they have accepted that, the responsibility of their task, that they are accountable for that task, and that they will complete that task as it should be performed. So when you think about delegating tasks, remember these things. It has to be the right task to the right person. Okay? It needs to be the right circumstance. You need to provide directions and maintain communication with that person that you are delegating to. Remember that you have to continue to supervise that task or that individual that you delegated that task to, and you need to evaluate how that task was performed and what were the results of that task. So there are many things that you need to think about. You need to think about the context of that task at that particular moment with that patient and with your healthcare team and who you're going to delegate it to. So delegation is not always going to be the same every time because your patient is going to be different. You may be working with different individuals who may have different skills and competencies. You're going to be working with different tasks. So you need to maintain and look at it within the context of that particular situation. Okay, that is delegation and prioritization. And after this, you can then, I have posted some questions that will be your assignment to answer based on prioritizing care and delegating tasks. That's it. Bye.